Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. The topic is TB concussion, laboratory diagnosis and help. When we talk of TB, we are more or less saying the traumatic brain injury. And what does that mean? It means blood entering or leaking into the brain, and it's a serious problem. It causes seizures and could cause death. It's a very serious because the brain is so made that blood must not enter the brain. If it enters, it means it has leaked out from the vessels, because the capillary of the brain itself is highly connected. It is only nutrients and necessary substances that the brain needs, including oxygens and what have you, that would go to the brain. That's why if you also check the CSF, that is the cerebrospinal fluid, you will dare not find red blood cells there. If you find WBCs, that is white blood cells, it's a case of infection or TBI. It could also be a serious problem, trauma. And so these kind of concussions that is usually experienced, and one of the experiences that I have is where a staff under me, when I was at General Hospital in Butemeta. The staff under me usually goes to his unit to collect his salary. Unfortunately, on this day, he fell from the motorbike and he was rushed to his unit General Hospital for treatment. But they didn't do anything to check whether with that little head injury, there is already blood leakage into the brain, which caused serious brain hemorrhage. But he felt okay and they released him, and he was coming to work until probably 2 weeks after, when he was seriously hospitalized and eventually lost his life. It was a serious problem because ever since, when I hear people say they fall, especially elderly people say they fall, I ask, do you hit your head on the ground or what? And if they say so, I would say, you need to probably do an X-ray or scan of your brain. But these are things that people fear because of the complications of radiation. But right now, the laboratory is in a place to really help to diagnose that there is a leakage, blood leakage happening in the brain. And that is what I shall be exposing in the slide session. And the help the laboratory can give is in that direction. So, as usual, click like, subscribe, and join me as we move on, explore more knowledge on this matter, TBI, traumatic brain injury, and the laboratory assistance. The outline, objective, introduction, prevalence, laboratory diagnosis, lab help, and conclusions are all I shall be talking about in this video. The objective, to expose brain biomarker tests that could be done in medical laboratory after a head injury that could result in TBI or concussion if the necessary investigations and treatment are not done. The introduction. Traumatic brain injury will cause concussion, as shown in this diagram. Is one of the causes of brain hemorrhage. If blood leaks into the brain, can cause a life-threatening medical emergency called hemorrhagic stroke or a brain bleed. The pooled blood increases pressure on brain tissues, preventing oxygen from reaching brain cells, which can lead to damage or death of those cells. This can cause symptoms like weakness, vision problems, difficulty speaking, and seizure, and requires immediate emergency medical attention, or else the person dies. The continuous capillaries in the brain don't have any gap. This is one of the reasons why blood do not reach the brain. And their
surrounding basement membrane is also thicker. These capillaries are part of the blood-brain barrier, which helps to protect the brain by only allowing the most essential nutrients to cross. The glial cells explain clearly the blood-brain barrier that prevents blood from entering inside the brain. This diagram that we are seeing shows some glial cells. One of them is the astrocyte in green color attached to the blood vessel. You can see it is just making sure that only the nutrient, those substances that is needed by the neurons. The neuron is in the brain cell itself, and it serves the neuron to get this necessary requirement. It is attached to the synapse here, the tentacles of the neurons, and you can see another type of glial cell called the oligodendrocytes attached to the neurons there. These are another microglia, and they perform different functions apart from making sure you protect the brain. They remove things that could cause problem. They are more like defense of the brain. The prevalence. More than 50 million people worldwide sustain a traumatic brain injury annually. The prevalence of brain hemorrhage varies by cause, with spontaneous intracranial hemorrhage occurring at about 20 to 30 cases per 10,000 people annually. When you talk of this spontaneous type, it's like where you have stroke, high blood pressure, hypertension, and those with serious complications. And then the traumatic brain injury having an even higher global burden, with over 60 million cases each year. The incidence of both is rising, particularly in certain populations, and both are leading causes of morbidity and mortality. Now let's return to talk about glial cells, the brain biomarkers. Glial cells normally produce some proteins that their derangement from normal value are indicative of traumatic intracranial injury or brain hemorrhage. They are the glial fibrillary acidic protein called GFAP and the UCHL1. The UCHL1 is very useful very quickly once the injury is sustained within 6 to 8 hours, and the value rises. So, and it returns to normal level within 12 to 18 hours, making it a good indicator in the initial hours after trauma, so that you can easily test for the UCH very quickly, even in the side laboratory. GFAP, this protein rises later, peaking around 20 hours after the injury. The remaining detectable for several days. It can be particularly useful for evaluating injuries that last. Laboratory diagnosis. Evaluation of GFAP and UCHL1 in blood sample of patients suspected of having intracranial injury could be done in the side lab or even the main lab, and this will show as increasing above normal, and the UCH will return quickly back to normal within 18 hours after the injury. So it is a very useful test for accidents that just occurred, whereas the GFAP could be done even after 2 weeks of this accident. CSF microscopic examination showing red blood cells over 1,000 per cubic millimeter is indicative, MM3. These biomarkers tests are very useful even when CT scan or X-ray is negative in an injury, and provide a wide diagnostic window, what that is within 2 weeks or more after the injury. Laboratory help and conclusion. The ISTAT TBB plasma test is a specific protein biomarker test for estimating GFAP and UCHL1 values to help doctors determine if a CT scan is needed for a possible mild traumatic brain injury. This test can help in the rapid evaluation of a concussion, especially when CT scans are normal and have high negative predictive values. By way of conclusion, the morbidity and mortality rate of TBI will be drastically reduced if we avail ourselves of this opportunity of using these brain biomarkers to monitor or evaluate intracranial bleeding that may result into concussions and avoidable death if we had discovered it early, just like cancers. If you discover cancer before it even starts really spread, really showing the stage 1, that is at the 0 stage, you can easily yank it off and stop the growth. So the same thing with intracranial deaths, TBI deaths. So like I've always said, this is the 202 video. There are so many health videos that treats health matter. Health is wealth. If you like what I'm presenting, subscribe and increase the viewership. Thank you.